6. New guidelines aim to create better individualized patient care at Intermountain Medical Center. Doctors within the thrombosis program at IMC must decide which intravenous technique is right for each patient. Well, that can mean an IV versus a PICC line versus other methods. In our continued partnership with Intermountain Medical Center, we learn what goes into a patient's veins could be a matter of life and death. At 15 years old, Becca Meek was treated for mononucleosis at Primary Children's Hospital.
I started having more digestive problems, more abdominal pain whenever I would eat, and just feeling more and more sick, and then things have kind of progressed from there.
Quickly leaving a 5'6" Becca weighing just 60 pounds. So doctors had to figure out how to get the nutrition and medicine she needs. The different methods are shown here on the model chest named Chester.
Is actually planted underneath the skin, and if we were able to magically pull away and look underneath, it resides in the muscle of the patient's chest, and then that device can be accessed with a needle on a reliable basis going through the skin.
It works for many cancer patients, but Becca had major complications from the implantable port, and she can't use a normal IV line, so doctors switched to a PICC line.
I get TPN through the white one, and then this is for my fluids and medications.
Have you take a couple deep breaths?
Intermountain Medical Center Thrombosis Program Co-Director Dr. Scott Woller.
By choosing the right device, by employing it optimally, and by following that device reliably, we reduce risks not only of infection, but also of blood clots. Good.
That's why the thrombosis program at IMC implemented new guidelines.
What device is best for the patient in front of me at this time, and how can I assure that the patient is getting the treatment that's tailored uniquely to them?
My TPN and one for the saline.
Becca must carry her life-saving supplies in this backpack at all times. Despite her health concerns, Becca stays optimistic through her love of animals. She raises rabbits, and together they win rabbit shows in Salt Lake.
People are always asking me if I'm depressed because it would be hard to go through things like that. I really don't feel like that. I feel like I have a pretty positive outlook about things, and I really feel like everything's going to be okay.
Dr. Woller says when you go to Intermountain Medical Center as a patient, you won't likely notice a big difference. The proof will be in limiting the number of complications like blood infections or blood clots.